Hello, everyone. My name is Muryah Torres, and today I am going to be talking about eye diseases. So for today's agenda, I'm going to be talking about an array of different eye diseases. So I'm going to be talking about myopia, hyperopia, presbyopia, astigmatism, cataracts, and glaucoma. So eye disease is categorized as anything involving the eye that deviates from, the body's original blueprint as to what an eye should be. So the first few eye diseases that we are going to be talking about are actually called refractive disorders. It's going to be myopia, hyperopia, presbyopia, and astigmatism. So a refractive order is just an umbrella term used to describe the types of disorders that occur when the eyes cannot clearly focus the images from the outside world. Then we'll be talking about some other pretty common eye diseases such as cataracts and glaucoma. So first off, we're going to be talking about myopia. You might have heard of myopia as nearsightedness. That's what people normally know the disease as, but they are the same thing. So myopia occurs when the eye grows too elongated from front to back. So it has more of like that football shape, and that causes for the light that's reflected in to actually land in front of the retina as opposed to on the retina, which is the focal point that the eyes normally have. And this slight abnormality causes someone with myopia to view things far away as being blurry, but stuff that is clear, they can still see. I mean, stuff that are near, they can still see clearly. As you can see here, this is someone with normal vision. This is someone that has myopia, myopic vision. So because someone that has myopia, their eye is constantly trying to focus that image, even though it can't, that causes eye strain and headache. So someone who has myopia might suffer from those symptoms. And if that disease becomes too severe, a patient has the potential to develop other more serious eye diseases, such as retinal detachment and more. Myopia usually develops during the ages of 6 to 14 when our eyes are just finishing up developing and their sizes. According to the National Eye Institute, though, children who spend more time outdoors during these years are less likely to develop nearsightedness, but experts aren't sure why. Personally, I think it might have to do with the increased screen time children face in those development years when, or children experience in those developmental years when they are indoors more. They watch TV more, the iPads, especially post-COVID. I'm interested to see how long-term studies show kids' eyes are after, post-COVID, kids are inside more. So I'm wondering how that's just going to affect their vision. Nearsightedness is actually very common in the United States, affecting more than 40% of the population. So it's almost half the people in the population experience some form of myopia. It can be treated, though, by wearing corrective lenses or even surgery. Next, we are going to talk about hyperopia. Hyperopia is more commonly known as farsightedness. And this disease occurs when the eye in the Yes, it occurs in the eye when the eye is actually too short from front to back. So the complete opposite with myopia. So the eye is too elongated from top to bottom, and that causes the light to reflect into the eye um, and go past the retina, which it's you can see in this diagram here, the retina is right here, and the light actually reflects behind it. So that causes someone's vision who has hyperopia to appear blurry up close, but things that are far appear more clear. And again, just like myopia, because the eye is constantly trying to focus that light that's being inputted, someone who has hyperopia might experience some symptoms of eye strain and headaches, when they aren't wearing any corrective lenses. Um, Hyperopia is actually very less common as opposed to myopia. It affects only about 5 to 10% of the United States. Hyperopia can be treated by wearing corrective lenses or surgery. Next, we are going to be talking about presbyopia. So presbyopia is a refractive error that causes someone's ability to see things up close to decrease over time due to aging. So even though it shares similarities with hyperopia, it's very different. It doesn't have anything to do with the eye shape. It has to do with the eye's lens. So presbyopia occurs because as we age, the lens in our eyes hardens and loses its elasticity. And in turn, the eye loses its ability to focus the light. So it doesn't have anything to do with the eye shape, just like myopia and hyperopia, but to do with the eye's lens. And it's over time, it hardens and the elasticity of the lens decreases. So the light, instead of reflecting on the retina, it reflects behind the retina, which is something that it has similar to hyperopia. So because we all age, we all are going to experience presbyopia at some point in our life. It's just a normal part of aging. And treatments for presbyopia include corrective surgery or corrective eye lenses. As you can see here, I, included an image of a guy trying to focus what's on his phone by using his glasses and holding something at an arm's length away. And that's normally like the indicator. If you could just walking by, you can glance at someone and you see someone like trying to view something like this, it's a high chance that they have presbyopia, because it's so common and it occurs in everyone as we age. Another refractive order that we're going to talk about is astigmatism. So astigmatism is another refractive error where the eye's cornea has an irregular shape. So the eye's cornea is going to be that outer layer of the eye right here. Unlike hyperopia or myopia that's caused by the shape of the overall eyeball, astigmatism is solely because of the cornea's shape. This abnormality causes light to be distorted in many different ways. And symptoms can include light to be seen as double vision, blurred lights, haloed lights, streaky lights, and extreme bright glares. As you can see in this example here, if it's nighttime, someone with normal vision may see like this, but someone with astigmatism, the lights are more streaked, they're spread out more. During the day, it looks more of like blurred double vision. Someone that has astigmatism may notice their symptoms become more prominent at nighttime, because at nighttime our eyes are taking in more light for us to be able to see. So as you can see in this diagram here, the shape of the cornea is actually just a slightly different from what the normal shape of the cornea should be. And that slight abnormality still causes light to be reflected onto multiple focal points instead of just that one focal point being the retina. Astigmatism is actually the most common of all eye refractive errors, occurring in about 1 in 3 of all people. And this disease, again, can be corrected by wearing corrective lenses or eye surgery. So that does it for refractive orders. Now we're moving on to other types of diseases. And that disease that we're talking about is cataracts. Cataracts can occur in people as they age, or if they suffer from any other eye-related diseases, or even an injury. So as time progresses, the proteins and fibers in a person's lens begin to break down and clump up. And this buildup is referred to as cataracts. The cataracts build up and cause the lens to become thick and cloudy, scattering the light and preventing it from fully reaching the retina. As a result, the person's vision becomes cloudy and blurred. So this buildup tends to happen over time. So in earlier stages, someone developing cataracts can get by with just using brighter lights to see, or even some eyeglasses, over-the-counter eyeglasses. But when cataracts build up and it becomes severe, the patient can undergo cataract surgery, which is fortunately generally safe and an effective surgery. So as you can see in this image here, your normal lens is clear, but as we age, those dead proteins and stuff, they clump up, and it causes the light that's being reflected through the lens to just bounce all over the place. And there can be many different symptoms of cataracts. People with cataracts can see many different, like, it's not just everyone sees blurred when they have cataracts. It really all depends on where that protein where that like dead protein has settled, if it's settled at the outer edges or in the middle. So people with cataracts can have many different types of vision obscurities. So as you can see here, like, they can have normal vision, this is normal vision. They can have dull or yellow vision from cataracts, blurry or dim vision, or distortion or ghost images from cataracts. Risk factors of cataracts include aging, diabetes, high blood pressure, eye injury or surgery, excessive exposure to light, excessive alcohol consumption, or prolonged use of corticosteroid medications. Corticosteroid, that is like a mouthful. So like presbyopia, cataracts are a part of aging. So we'll all develop cataracts at some point in our lives, but there are lifestyle changes that you can do to slow down the process of developing this disease, such as monitoring your health, limiting alcohol consumption, and wearing sunglasses when you are out in bright sunlight. Next, we are going to be talking about glaucoma. So glaucoma and cataracts, they're not related, but they both tend to develop in people as they age. So there's a high chance that someone suffering from one disease may also be suffering from the other simultaneously. And glaucoma is just an umbrella term used to describe eye diseases that cause an increase of intraocular pressure. So when the fluid in the eyeball, which is called aqueous humor, as you can see from this image here, when it builds up and there's an increased pressure within the eye, the intraocular pressure causes damage to the eye's optic nerve. Excuse me while I plug up my laptop. All right, there we go. So the eye's optic nerve is what's responsible for relaying messages from the eye to the brain. So if that nerve is damaged, vision loss occurs, or in some extreme cases, even blindness. Symptoms of glaucoma can start slowly, and the damage it causes cannot be undone. So that's why it's so important to treat glaucoma as soon as there's been a diagnosis, preferably before it starts to affect your vision, right? Because there is no going back from the damages that glaucoma has caused. And the only way to diagnose glaucoma is with a comprehensive dilated eye exam. So make sure that you get your eyes checked annually, especially as you age. Treatments for this disease include medication, laser surgery, or in some cases, eye surgery. So it's only treatment to slow or stop the progression of glaucoma. Like I said, the damage that glaucoma does cannot be undone because it damages your optic nerve. Some symptoms of glaucoma can be blurred vision, loss of peripheral vision, vision loss, noticing more of a glare, letters on a page appear dim when reading, and difficulty distinguishing color. So that concludes my presentation. Thank you guys for listening. Something that my biggest takeaway from doing this research was just how fragile the human body can be. Even the slightest bit of something off can really cause like dramatic lifestyle changes. So after doing this research, I'm going to make sure that I get those annual eye exams and just really have more of a conscious when it comes to my eye health. And I hope that had the same effect on you as well. Thank you.